A group of passionate and dedicated clinicians, system leaders, commissioners, academics and third sector colleagues have for the past 3 years collaborated across the Wessex region to support the implementation of best practice for helping people to self-manage their long-term condition. Over the last 2 years, we have created the Wessex Activation and Self-Management Programme. This group has worked on understanding, learning and sharing the concept and practical implication of patient activation and how services are supporting people to manage their own health and care. This created a real buzz around self-management, and we supported teams across the region to introduce the concept of tailoring care to patients' level of activation as well as their medical complexity. However, what became apparent was that the areas that were starting to change how they were working collaboratively with patients were doing so in spite of the system rather than being facilitated by the system. Despite there being a plethora of good evidence and guidance for how teams and clinicians could combine person-centred approaches to self-management with the more traditional and reactive approaches to patient care, uptake has been low and slow. So, in 2017, we felt before we could expect patients to adopt self-management principles, we need to better understand the factors that would influence clinicians' behaviours in adopting person-centred care. Only by gaining a better understanding of what these barriers are, we would be able to support other teams in the systems and to individualise their own operational and cultural challenges that are stopping the culture shift towards delivering supportive self-management. With support from clinicians, academics, commissioners, managers and health educators, the WASP Group designed a self-assessment survey based upon the best practice guidelines. This survey assessed not just clinicians' opinions but also the opinions of managers in provider organisations and CCGs, and then compared this with the views of patients that are partners in their care. And the survey topics followed optimal delivery from pre-consultation to consultation and post-consultation follow-up. The survey also analysed topics based on the COMBI model of capability, opportunity and motivation to give an understanding of not just what is happening, but what the perceived barriers and enables were for the teams at each stage of the care pathway. In 2018, we undertook a sample survey with services and organisations providing diabetes services across the Wessex region. Our initial results suggest that our original hunch that it wasn't just a lack of knowledge about personal-centred care that was limiting its clinical uptake was probably true. And of equal importance, the novel approach of behavioural change analysis of systems rather than individuals provide an indication of why and where these barriers and enables were across the system and patient pathway, highlighting that most people believe self-management is good for patients and clinicians, and because it is not happening, is not down to a lack of belief in self-management. They also think that in general they know how to do it, although the patient survey would suggest that clinicians and managers aren't as good as they think they are at it. What also was really clear was that the system and structure is not coordinated from the CCG down to the patient as it could be, and that frontline clinicians don't always feel they have the tools and structure to support the implementation of personal-centred care that their managers and commissioners think they have. However, as successful as this evaluation has been, it is only a snapshot, and to develop and to roll out this novel approach across the region and wider, we would like to work with the Health Foundation to use the current data to refine and develop the survey to make it more user-friendly and package it in a way that other areas and teams will be able to use it to analyse and benchmark their services. We would also like to undertake greater analysis across different pathways and locality systems, including the voluntary and social sector in Wessex. To go along with the survey, we would also look to co-design a facilitation intervention package to provide the health system with an in-depth analysis of where good practice and behaviours are supporting people to self-manage, whilst highlighting where there are areas for improvement and helping them to problem solve how they may address these. And then finally, like all good QI initiatives, we would like to re-evaluate the effect of these interventions on the original teams and systems that were first analysed. Before we can expect patients to self-manage their condition, we have to recognise that behavioural change starts with us as clinicians, provider organisations and commissioners, and we are really excited about the potential opportunity to work with the Health Foundation on this journey to developing and empowering the workforce and patients.